Hi, we're going to do a total facial rejuvenation and we're going to focus on neurotoxin as well as fillers. There are some long-standing frown lines. You can see the formation of these lines. It takes years to form. And again, the lines themselves don't disappear magically with neurotoxin. They do require lifting and require brow lift, but you can get them to prevent from getting deeper. But also with fillers injected properly, you can prevent them from looking as deep. A lot of people are afraid of injecting this area because there's been some vascular occlusions. If you know the anatomy, if you do it properly and safely, it's perfectly fine. But for the average injector who just learned how to inject in a weekend course, please stay away from that area. You're going to see the mid-face needs to be lifted and you're going to have more contour, more of a heart-shaped face. And then ultimately, once this is done, we can work around the mouth, even the chin and lips. But first, we're going to start with the upper part of the face. So hang tight. We're using Daxxify, Daxi for its longer lasting results. It's a little bit less comfortable, but it lasts longer and it's worth it. My assistant is going to use ice on the other side of the face for comfort. And we are going to do Daxi to the procerus muscle, the depressor supercilii. Again, I'm calling the names of the muscles. Compared to Botox in this sport, it is a little bit less comfortable, but it does have longer lasting results. As you see, this muscle's pulling the eyebrow down. You can actually watch the eyebrow pull down. As I pull it up, look, the muscle wants to pull it down. So by injecting Botox, Dysport, Daxi the right way, you actually release that pull and open up the eyebrows a little bit. The most average injectors, what they do is they paralyze the forehead and they actually make this problem worse. We don't want that to happen. I barely treat the forehead. You'll see in a second. I also don't want a Spock eye, so I do a little drop here to prevent a Spock eye from forming. But again, as we get older, this gets heavier, so I don't want to overdo this because we don't want to drop it. We go on the other side, do the same thing. Give her a little break. You can see the active muscle. It's pulling in this direction. And this is gonna, in a few days, it's gonna open up and prevent from doing that. We're gonna stay symmetric and do a little drop here to prevent the Spock eye, but I do want a little bit of a lateral lift. Now, I'm leaving the forehead alone. I want this muscle lifting. I want her frontalis lifting, but I'm gonna do it one drop in the middle. This actually weakens the frontalis in the middle and allows the outside to lift even more. I'm going to come back here in the middle section and place a bigger drop and let it spread into the muscles that are acting on her anatomy. Her anatomy is all about procerus, depressor supercilii, and corrugators pulling things down. So that's where I'm going to focus on her. Hold pressure. If you hold pressure, you will not bruise. So we're going to do that, and then we're going to go to the outer eyes. So next, I'm going to go, and in her, I'm doing one drop to the lateral canthus. And then I'm going to do one drop underneath her eyebrow at the tail of it, and this gives her a little bit of a lift. I'm not doing underneath because I don't want the eyes to look hollow. I'm not going under here. I'm doing the lateral canthus, so when she smiles, the eyes stay more open. Daxxify does burn more. It does burn more than Botox. It is less comfortable than Botox. That's the downside of Daxi. Plus it costs more. The upside is quicker results, longer lasting results. So now we're going to focus on midface. You can see that the midface is drawn down. It's hollow here, and then you get the fullness here, and then the hollowness there. So we're going to go and focus on refilling, revolumizing the midface. I am all the way down vertical. I am on top of the bone. People say, well, are you going to withdraw and check for blood? No, there's no need to. I'm right on top of the bone and I'm vertically down. There's absolutely no need to do that here. There are some places that I'll do it. You'll see me at the tip of the nose, I'll do it. There's certain areas that must be done. When I'm here, I'll do it. But in this area, does not need to get done if you do it the right way. Now you'll see me again, I'm going vertical. I'm going down through any blood vessels on top of the periosteum. And what you'll see immediately, compare this side to that side, see the flatness, and then you see the lift on this side. Again, going vertically down. I have seen plenty of injection videos on Instagram where I see injectors going in these areas. That's not the right way to do it. You don't want to inject in the soft tissue. You're going to make it heavier. Plus, if you go this way, you can thread it into a blood vessel. So you don't want to do it that way. Technique comes with safety. All right, so that's one syringe, and immediately we got a lift right there. So here we go. We're going to a second syringe. Again, straight down, top of bone, adding volume. Straight down, and very little bleeding. I don't see any bleeding yet. You're starting to see the lift. A lot of injectors kind of go out here and start with the V1. Youth, that youthful look comes from midface, not out here. So you want to first volumize the midface and then start to work laterally and inferiorly. So once that's done, then I go out to V1, V2, then I go to V4. And I don't want just something large standing there. I want everything to be filled together. Now we're going to do a little bit to the smile lines. Injecting basically the entire right side of the face. So the corner mouth came up like that. A little bit to the jawline. Give more definition here. Jawline, better structure, and it'll blend into the jowls. The jowls are here, where what we're doing is we're going in front of it and behind it. By doing that, we minimize the appearance of the jowls. This. These are down deep. These are not microdroplet. These are larger boluses. Because we're trying to minimize the number of times we poke in and out. This is not an area you want to do cannula. You don't want to be going along the face. You want to go longitudinally and create lift. Typically, most patients have a better shaped, contoured left side than the right side. Therefore, if you're doing cheeks injections, you'll see that you'll need a little bit more volume on the right side than on the left side. Typically, the left side is more narrow and higher, so it looks better. The right side is typically wider and droopier. So to try to create more symmetry, you lift the right side more compared to the left side. But in her, we still want a little bit of a lift on the left as well. And you don't want to create sharp lines, so you want to blend it and contour. You feeling okay?
Yeah.
Okay. All right, let me see you again, sitting up a little bit. Yeah, see you later. Do you need a drink or something? You okay?
Yeah. So I'm okay.
You're okay, okay. This is basically the piriform aperture, or the very top of the nasolabial fold. You're going to benefit from larger boluses on most people. And then we start working our way down. What I've done is I've swapped the needle and put a smaller needle than the one that comes with the filler. So it takes more force on the injector's point of view to inject it, but it results in a better result and less bruising. And then we can come back even like in a week or so when the swelling and stuff, bruising goes away, take more pictures. So the proper technique for frown lines is there are neurovascular bundles that are coming up here. Supraorbital and supratrochlear vessels are coming up there. You don't want to be injecting intravascular, but you have to add some volume here. So what I do is I first start by deep injections, down to the bone. Again, I'm down to the bone, there's no blood vessels, and I'm pulling up. So the injection is here. Now as I go here, the neurovascular bundle could be there. So I would withdraw, then I fill. And I'm still drawing out. And if you just compare these two, if you come around with the camera and just look at these two sides, you can see this scowl and this side. You can actually see how different they are. It's already filled in without even the Daxxify kicking in. This side, you can see this deep line. In this area, if you tilt your chin up a little bit more, you can see that basically so smooth, and here you got the line. So we're going to continue and do the other side as well. I'm starting with a deep injection down to the bone in a safe area, drawing up to add volume. And then the next one is a little bit lower. Here, I'm going to withdraw, and then draw back, and again, add volume as I go up. Now here is where you can really thread potentially into the blood vessels, and you don't want to do that. So if I'm doing it this way, I'm definitely drawing back, making sure there's no blood vessels, there's no blood cells, there's no red blood cells, and then I'm again injecting retrograde. I'm going back here, doing the same thing, drawing back, make sure there's no blood vessels, drawing retrograde, pulling back. So that is going to open up this area much better. Now you don't want to create too much bulge and fullness in women because it's going to become masculine. But there's also a part here that's actually the root of the nose that's creating the depression. So I'm basically doing the root of the nose as well. And these, in combination to when the Daxxify kicks in, will look like a brow lift. So I'm not necessarily doing this for the nose itself. It is going to improve the dorsal hump, but what it's going to do is it's going to improve the frown. And she will look like she's not frowning anymore, and it will look much better. Thinning of the lips is one of the biggest signs of aging. And again, a lot of people are afraid of duck lips or full, Instagram style lips if they're older. But unless you actually add some volume to the lips, you really can't rejuvenate around the mouth. That whole mouth is not about lines, it's about a zone. And you gotta rejuvenate that zone. So we're gonna do a subtle lip augmentation. We're not trying to make her into Kylie Jenner. We're just simply trying to add a little bit of youthfulness back to the lips. And you can already see, if you come, you can already see you got definition to the vermilion border. Because with age, we lose definition to the vermilion border. The vermilion border thins out. If you actually look straight on, you'll see definition on the vermilion border here, and over here is flatter. So that's going to improve. And we're going to continue doing that. Very subtle, very natural, but you just can't be afraid of it now. How many syringes have we gone through, Caitlin?
I think about 8 or 9.
I'd say more. We'll show you how many syringes we did at the end. But most patients are scared because they've seen their sister, their neighbor, their cousin, somebody on Instagram look really weird, look really puffy, look really fake, and they don't want to do this. A lot of other patients, it's cost prohibitive for them. I mean, once you start doing this many fillers, it becomes quite expensive as far as the number of fillers. So they just want to do 1 syringe or 2 syringes. And you can't. You cannot rejuvenate a face with 1 or 2 syringes. It just doesn't happen unless all you need is truly a little bit. But typically by the time we hit our 50s, 60s, and beyond, you need quite a bit of volume. And I'm going to show you in a second that volume can be added in a very normal way. Lots and lots of volume, but it can still look supernatural. So it does not have to look fake. It does not have to look puffy. It does not have to look weird. I mean, I can put 10 syringes, and I think we've done more, and they can still look extremely natural. So the take-home message here is, don't be afraid. Do it the right way, but you have to go to a master injector. I mean, if you go to a place where all they're doing is just filling you without analyzing your face, without having the understanding of what a human face should look like, age-appropriate face, we're not going to make a 60-year-old's face look like a 16-year-old. It just doesn't work that way. But if you do it the right way, you can get beautiful results and look very natural. It just re-inflates an area that's been deflated. You can see that there's looseness to the mucosa because she had fuller lips when she was younger and it's settled down. So we're not trying to change her from what she was, we're just trying to take her back to what she was. Smile really big for me, big smile, relax, perfect. She's got very strong muscles right there pulling up. Okay, done.
Merci.